We have two people at the microphone. Can each of you ask your question, and then we'll try to summarize. Thank you.
Hi, good to see you. Asaf Bitan, Ariadne Labs, Harvard School of Public Health. You know, I think one of the surprising and positive upshots of what we've gone through in the pandemic is the realization that the healthcare system now sees itself a little bit more outside the four walls. Sees itself as having perhaps a public health mandate. And so I'm wondering, as you're thinking about reforms in the CDC, beyond making these necessary data interconnections, which are so critical, what are other ways that you are thinking about connecting more that bridge that's so critical between formal healthcare and formal public health?
With regard to healthcare, I think you're totally right. I think that one of the things I really worked hard to do when I was chief at Mass General was to say, like, our STI clinic is run by the state. Why don't we talk to them very much? And so, like, why we need to have more fluid communication with our state labs, right? So we do need to foster these connections. I do think the pandemic has given us this opportunity, even from a vaccine standpoint. Or even a case standpoint, if we had laboratory case reporting at CDC, but we didn't have comorbidity data that lied in the hospitals, then how could we look at how, comorbidity, and how could we even examine that? If we had vaccine data that lied with the states, but comorbidities or hospitalization rates that were in the hospitals, we couldn't connect the two. So one of the things that we're actively working on, and I'm working with ONC on this right now, is to say, once we get our pipes connected, and we're working really hard to get our pipes connected, are they going to connect with the Epics and the Cerners of the world so that we can make sure all of the systems connect? And there are mechanisms by which that can happen. And I do think healthcare is motivated to do it because, again, bi-directional highways with our partners.